Acupuncture is one of the oldest practices in Chinese medicine, originating from the arrival of Buddhists from India. It's still used today, often as a method of pain relief. It's used in most pain clinics and hospices in the UK, and a 2004 study showed that 1 in 10 adults in Australia use acupuncture. In Japan, it's estimated that up to 25% of the population will receive acupuncture at some point in their lives. In 1972, Richard Nixon, the President of the United States of America at the time, visited China and was shown a patient undergoing major surgery while fully awake, and they received acupuncture therapy rather than anesthesia. However, it was later found that the patients had high pain tolerances and were given strict instructions before the operation, as well as secretly receiving morphine disguised as normal fluids. In 2006, a similar incident occurred when the BBC documentary entitled Alternative Medicine filmed a patient undergoing open-heart surgery under acupuncture-induced anesthesia. It was later revealed that the patient had actually been given normal anesthetics. In this video, we'll go over what acupuncture is, when it's used, and 7 health benefits you can receive from it. If you want to see more videos like this going forward, do be sure to like, subscribe to our channel, welcome to wellness, and hit the bell so you can stay up to date on how to keep yourself healthy. So without any further ado, let's get right into the video. So what exactly is acupuncture? According to John Hopkins Medicine, acupuncture is the practice of penetrating the skin with thin, solid metallic needles, which are then activated through gentle and specific movements of the practitioner's hands or with electric stimulation. In traditional Chinese medicine, it's believed that the body has over 2,000 acupuncture points connected by pathways that create a flow of qi throughout the body, which is responsible for overall health. If the flow of qi is disrupted, it may lead to disease. Thus, the point of acupuncture is to restore the flow of qi throughout the body in an attempt to restore the patient to full health. In ancient times, acupressure was popular in India, as well as the religion of Buddhism. Once Buddhism spread to China, the practice of acupressure was also integrated into common medical practice. The major points of acupressure and acupuncture are very similar, and so acupuncture was born. An article in Rheumatology claims that the first usage of acupuncture was in the Inner Classic of Huang Di in roughly 100 BC. The first evidence of needles was discovered from around the same time period when gold and silver needles were found in the tomb of Liu Shang. In the first half of the 1st century AD, acupuncturists believed that its effectiveness was influenced by the time of day, the lunar cycle, and the season. According to Needham and Liu, the ancient civilizations tracked this through a series of complex charts and special terminology. Studies have shown that acupuncture is effective for a variety of conditions such as headaches, lower back pain, and even addiction. The effects of acupuncture can vary depending on the symptoms being experienced and whether the person is in pain, although there is still a variety of benefits to acupuncture. Now that we know what it is, what does it actually feel like when receiving acupuncture treatment? Acupuncture is usually carried out using hair-thin needles, which are so small that the majority of people experience minimal, if any, pain whilst they're inserted into the body. The needles are inserted into points in the body that are the source of some kind of pressure or ache. Sometimes the needles are heated before therapy begins, or an electric current is sent through them. What's funny about acupuncture is that although some people feel energized after acupuncture, a large amount of people also say that they feel relaxed afterwards. As mentioned before, there have been several cases in which acupuncture has been used both during and after surgery. It's important to note that acupuncture during surgery is usually used in conjunction with normal anesthesia. Are there any risks to acupuncture? Since the needles are physically entering your body, there's a small amount of risk involved. For example, the needles can actually cause pain rather than treating it if they're placed incorrectly. Needles must be sterilized to prevent infection, which might be why some practitioners prefer to heat their needles before therapy begins. Therefore, it's important that you seek treatment from a professional, qualified practitioner. Acupuncture needles are also regulated by the FDA, just like any other piece of medical equipment. When it first came around, acupuncture needles were not only much thicker than they are now, but they were also unsterilized. This, of course, resulted in lots of infections, although when infections occurred, the ancient practitioners thought it was caused by using the wrong needle or the needle being on the wrong place at the wrong time. Later, needles were heated in boiling water and sometimes used while they were still hot, creating a cauterizing effect around the area where the needle was inserted. It's said that people with serious spinal disease or cancer are not good candidates for acupuncture. There are also conditions that are not treated with acupuncture, including hemophilia, advanced liver disease, warfarin use, severe psychiatric disorders, and skin infections. Electroacupuncture also cannot be used at the spot of implanted electrical devices like pacemakers. Now let's look at 7 of the health benefits that acupuncture offers. Number 1. Chronic pain. According to the National Institute of Health, a number of studies have shown that acupuncture helps to relieve chronic pain, particularly back, neck, and knee pain. Other studies have concluded that it's effective for chronic pain treatment. The effects persist over time, and the benefits cannot be explained by the placebo effect. The authors of the study have stated the results confirm and strengthen previous key findings that acupuncture has a clinically relevant effect compared with no acupuncture control. They also go on to state that effects may last up to 12 months. However, they also warn that other factors may have contributed to the benefits of the procedure, although acupuncture would be a reasonable option to consider in patients with chronic pain. Number 2. Hypertension. For those who may not be aware, hypertension is a fancy term for high blood pressure, but can lead to health problems such as heart disease. Emerging evidence has suggested that acupuncture has the potential to lower blood pressure in patients with hypertension. It's believed that this is because acupuncture activates a variety of different pathways throughout the body, which is similar to what the ancient Chinese practitioners used to believe. This is important because, in the United States, roughly half of the general adult population is said to have hypertension. Thus, it would be useful for almost half of the US adult population to seek a treatment such as acupuncture to help with high blood pressure. Number 3. Insomnia. Gary Stanton, a sleep medicine specialist at Emerson Hospital in Concord, Massachusetts, has stated, despite the skepticism of some physicians, acupuncture is an increasingly evidence-based medicine. The doctor also considers acupuncture as one of the several treatment options for problems like chronic pain and sleep/insomnia. It's also been reported that people's sleep awakenings and self-rated anxiety also improved significantly 2 to 4 weeks after treatment. In reducing pain, as mentioned before, acupuncture has been shown to help sufferers of chronic pain, so it may also help pain sufferers sleep better as their symptoms are more manageable. Number 4. Anxiety and depression. Matthew Kulas, an acupuncturist at the Henry Ford Health System, states that acupuncture stimulates the body's natural feel-good hormones and reduces the level of stress hormones like cortisol. Studies have also shown that acupuncture may have been an effective treatment for anxiety with fewer side effects than some popular medications. There's also some research which says that acupuncture is an effective treatment for depression and related symptoms. In an 8-week study consisting of 151 men and women, researchers found that acupuncture caused a significant improvement in depression symptoms. Although it may not cure depression, as no such cure exists, acupuncture can be effective in managing the symptoms of depression and can serve as another form of treatment. Number 5. Allergies. Researchers at the University Medical Center in Berlin conducted a study on the effectiveness of acupuncture treatment on hay fever involving 422 people. The study revealed that the group that received acupuncture therapy reported greater relief from symptoms than those who didn't receive acupuncture. Some researchers may disagree, although acupuncture may be a viable relief to allergy symptoms such as itchy eyes and a runny nose. As long as you consult a professional, there's very little risk in seeking acupuncture treatment for allergies. Number 6. Menstrual cramps and PMS. As mentioned before, acupuncture has been known to relieve pain. So it shouldn't be a surprise that it can also help to reduce the effect of menstrual cramps. There's evidence out there that may suggest that acupuncture is very effective for reducing menstrual cramp intensity and reducing the amount of time that the patient actually experiences pain. An advantage to acupuncture is that, unlike painkillers, acupuncture has been shown to potentially reduce the pain experienced during future menstrual cramps rather than just reducing the pain that someone feels during one bout of cramps. As for PMS, its cause is unknown, although we do know that it's influenced by changes in the brain's hormone levels. Acupuncture can help to alter the chemistry of the brain, reducing serotonin levels but increasing the amount of endorphins in the body, so acupuncture may be effective in reducing the negative emotional stress that's felt during PMS. Number 7. Back and neck pain. There also may be evidence to show that acupuncture is effective for non-specific lower back pain, which was revealed in one study. However, the authors of the study stated that there were limitations in the study that was carried out. Although in 2017, a systematic review concluded that acupuncture was as effective for relieving neck pain as normal treatment, and electroacupuncture was found to be even more effective than normal acupuncture. Overall, it's clear that acupuncture has a wide variety of health benefits for all kinds of conditions, so what are you waiting for? Call your local qualified acupuncture practitioner and give it a try yourself. Thank you all for watching this video. We hope you liked it and learned something new. Remember to leave a like and subscribe if you enjoyed it. What do you want to see from us next? Do let us know in the comments down below if you want to see more videos on alternative medicine or something more modern. If you want to stay up to date on all of our latest uploads, please be sure to hit that bell icon.